I think we all know somebody who we know is still suffering from a trauma in their lives. If you really think about it.
Oh, we know several.
Yes.
We know several.
You're right.
Yeah.
And they don't know what to do. But by this program, I'm hoping that somebody out there is saying, you know, I really need to see if I can talk to so-and-so and just present this. Not dig, not push, but just present this. As
Oh, there have been people who have kept these on their mantle for 6 months and then got it as a gift, you know, from a concerned relative or friend. And one day they just say, what the heck? And they'll listen to it. And that's fine.
And it can be transformative.
Yeah, it can.
This is very exciting. So you go around the country doing seminars?
Some. I'm getting a little long of tooth to be doing so much running around, so I'm trying to do less of it. But yes, I'll be doing something in Providence in the fall for some nurse practitioners, annual meeting. I'll be going to Chicago and Alexandria, Virginia to talk about imagery for cancer, which is really how most of it got started. Yeah.
Imagery for cancer.
Oh, yeah.
Let's hear about that.
Yes, imagery for cancer. Actually, some of the earliest studies from the 80s showed that guided imagery helped with the side effects of chemotherapy, pain, fatigue, nausea. And that was sort of for years, that was the standard, that it helps with side effects. It helps manage the distress of, you know, the symptoms of cancer. However, in the past 3 years, there have been 3 separate super studies showing that after doing immune-specific imagery, after blood work and salivary samples were taken, it was clear that natural killer cell activity and T cells, 4, 8, 16, all of them were elevated for a good 45 minutes. So think about that. If you know, there's still no proof that elevating your immune system function, all these immune cells, is going to kill your cancer. However, it stands to reason that it's not a bad thing. And eventually there will be those studies that have more long-term outcomes. But they've just proved that. That's very recent. And I've got 3 studies posted. We have a big research archive on our website. We add stuff to it every week. And in the past year, there have been 3 of these studies. It's really cool.
Oh, my.
Yeah.
Oh, my. First of all, the good news here is that we don't have to be passive and take anything, do we?
That's right. And the very fact that we're taking some measure of control is very good. It's good for optimism, self-esteem, efficacy in terms, and even adherence to treatment regimens. So you want people to feel like they're at least in charge of something. And yeah, they can do this. And in fact, what we train people to do in these workshops is, every time you do your guided imagery to elevate your immune system, you know, put your hand over your thymus. Just imagine that, you know, all these fabulous immune cells are scooting out all over and sort of sniffing out cancer cells and, you know, hammering them down to nothing. And then we tell people, work with this imagery enough times so that you have created what's called in Ericksonian hypnosis an anchoring device. Every time you put your hand here at a traffic light, when you're talking on the phone, when you're in a boring meeting, this is a perfectly normal gesture, really. You can be elevating your immune system. Your body will just do what it does. So.
Wonderful.
Yeah.
Very empowering.
Very empowering. Good conditioning cue.
Yes, we all need more of that.
Yes.
Definitely. Definitely. And people can have the sense of experimenting to see what works.
Oh, yes.
That,
oh, yes.
So again, healingjourneys.com.
Health Journeys. Right?
Health,
but
sorry.
You know, they can just Google my name. It's such a weird name. If they Google Belleruth, they'll get right to the website.
Nice.
It's one of the few advantages to having a strange name.
Excellent. Okay, we only have 10 minutes left at most. So what would you like to say that we have? What would you like to touch on that we haven't touched on or expand on?
We've done a lot.
Yeah, we did. We did. I'm afraid that the audience is going to be in shock. Just, you know, systems overload. You
Right.
know?
I guess I'd just like to say it's a technique that's worth trying for lots of things. And as I mentioned briefly, even for people who are dying, interestingly enough, the sense that it's the last to fade is hearing. In fact, it sometimes gets more acute as people are dying. Any hospice nurse will tell you that. And to be able to use this kind of sort of healing work, we have something for peaceful dying that's also very good for families. And this is something that can help with just about anything. And interestingly enough, people who are facing surgery, who are really pretty frightened, planned surgery, we get an unbelievable amount of adherence. Kaiser gets something like 85%. Blue Shield of California, 85% will do their guided imagery because they're scared. And the more scared they are, the better they do, the better the imagery helps. So we know that if we can get scared people to do guided imagery because they're facing surgery and they do really well with it, and men as well as women, then we know that this is something that can really help if people will use it.
This is just absolutely marvelous. And I know that there's one that's healthful sleep.
Yes, that's one of the most
so
popular
many of us, as we get older, deal with sleep problems.
Yes.
And part of it is waking up and the mind just leaps into full, got to do this, haven't done this.
Right.
And you can't go back to sleep.
No, you're sunk. Once you get to that list,
Yes.
you're sunk.
No, and so it takes usually an hour for me to read
Right.
to be able to let go enough to go
Right.
back to sleep.
You're distracting yourself with the content
Yes.
of a book.
Exactly.
Yeah, and
Putting
that's
myself
the-
somewhere else.
That's right. And what guided imagery does with that kind of sleep disruption is it's like a two-barreled approach. It really works. It's one of the best things guided imagery does. It distracts you with just enough what they call cognitive recruitment. That's content that distracts your mind with this little imagery story. But also because the tone, the words, and the music are soothing, it also speaks to your primitive brain and gets that to let go of the agitation that comes with thinking of that list of things to do.
Oh,
So it's really good. I mean, if you look on the comments on Amazon under this one, it's hilarious. I mean, all of these cynical naysayers saying, "I can't believe it! I fell asleep." It works.
oh, wonderful, wonderful. So I'm going to hold that up. Healthful sleep. This is at healthjourneys.com or Amazon. And it's maybe a way to start.
Actually, we do give that to people who are most resistant to the idea because they will do that.
That's right.
Yeah.
And that's such a basic
Very
level
wise.
and such a basic need.
Yes.
So well, Belleruth, this has been fascinating. I'm going to again suggest Invisible Heroes, and I have to read the other books now as well. I'm going to go to your website. I'm going to look at the tapes. I'm going to learn some more. I'm going to look at the research that's coming in every week.
Every week.
This
We
is-
have it's listed by affliction. So we have everything. We have over 2,000 abstracts now.
Oh.
Just on this stuff.
Just amazing, just music. Thank you so much for being
Thank
here
you.
today and
Thanks for
opening our
having me.
eyes and really getting us to think about not only what we can do for ourselves, but what we might be able to do for friends that we know who are in
Yes.
despair.
Yes.
Oh, thank you so much.
Thank you.